Welcome to Unit 1, Section 4, Assessment Techniques. In this video, I'm going to run through some basic information about passive range of movements before you look at various demonstrations. You will always get your client to do active range of movements first as part of your assessment. This is partially to allow them to understand what you want them to do while they're still in control. It will narrow down further range of movement tests for you and obviously start to give you some clues as to what's going on. As previously mentioned, active range of movements give you information about all the structures associated with that movement. That information might be pain, decreased mobility, tight musculature and poor movement patterns, as well as clicks, clunks and grinding noises. As before, you will get your client to carry out the range of movement on their good side first. Once you have completed your active range of movement, you will carry out your passive range of movement, giving you information primarily on passive structures, but will also give you some information when active structures are stretched, such as muscles. Passive structures include bones, ligaments, bursa and joint capsules, and will give you information such as pain, decreased mobility. It may give you information on movement patterns. If these are altered from a normal pattern, this may indicate a physical block, but if they are improved from the active range of motion, it may indicate that there is an issue in the muscle or tendon and not a physical block. It will also give you information about the joint end feel. This is how the joint feels when it gets to the end of the range of movement. There are various end feels, both normal and abnormal, and there are some additional notes within the resources folder which will help explain these. We will cover more about joint end feel in the clinic, as you can only really experience this through doing and feeling them. If you are able to get a chance to experiment with someone, it's worth giving it a try. For example, if you want to do the shoulder, put your hand on the glenohumeral joint and get your model to move through active range of motions and see what you feel. And try and explain what you feel back to them, because it will help you to understand what it is you feel. You can then try it again with passive range of movements and see how it differs, if it differs at all. Back to passive range of motion. It's important to explain to your client what you are going to do, and explain that they need to relax and allow you to take full control of the limb. Ensure they know they can ask you to stop at any time. It's really difficult to take control of anyone's limb. People find it very, very difficult to let go. But if someone is in pain, they're even more likely to be unwilling to let go. So you're going to find this quite difficult at times. So it takes a lot of practice. So try practicing on someone who isn't in pain and who's quite trusting of you. The more confident you are with your client, the more at ease your client will be and the more they will be able to let go for you. So practicing is really important. Ensure you support the limb and the joint well, using your body, your hands and your arms. This will make it easier. Start with the good side first and repeat the same movements as you did during active range of movements where possible. So for the course, you do need to duplicate the range of movements you do passive, active and resisted. But if you are working in clinic, you will not include the ones that have come up negative, so you can reduce them down as you go along. Generally, your passive tests are done with your client led down so that they are in the most relaxed position possible. From this information, you are looking for changes between data gathered during the active movements and the passive movements. For example, if the muscle is the problem and produces findings of pain during the active test, you would hope that it's decreased or gone during the passive test. As the structure is not involved in the movement, you've taken the muscle out by passively moving the structure. But remember, clients find it hard to let go, so you may find that there's either some input or fairly high levels of input from the muscle. So you need to bear that in mind. But that's one way you can see a difference between a passive and active and help to decide what the problem is. So key points to remember. Firstly, communicate well. Explain exactly what you're going to do. Remind the client that they can ask you to stop. Get the client into the most comfortable position you can and support the limb really well. They probably won't relax fully, but the better you support them and the better position they're in, the more they can relax. So there you have your basic information about passive tests. Now there are various videos for you to watch on the different tests that you can do. They're all on separate videos to make it easier for you to find. So you can now complete the quiz associated with this section and move on to the demonstration videos.